Rationale 2.7 Review of a Proposed Tobacco Control Program in Philadelphia, PA. Critique and review by Sabrina. Just to review, there are several components of an effective and well-written rationale for creating health promotion programs, which are typically reflected in an inverted triangle model. These components include identifying health priority and/or the priority population, providing evidence-based epi research on the impact on a global, national, state, and economic level, relationship between the population and the problem, a proposed solution, measurable benefits of the proposed solution, and why the promotion plan would be a success in that particular area or with that audience. And then, of course, it's important for references. While reviewing the review of the rationale for a tobacco control program in Philadelphia, I determined that the rationale had several strengths. One of the strengths was identifying the health priority and population. It was clear who they were targeting and what the problem was. They also did an excellent job of providing evidence-based epi research on a global, national, and state level and highlighting some of the economic costs. And here I highlight some of the things that stood out from each one of those categories. On the global, tobacco kills 6 million people a year. I thought it was nice that they included an ironic comparison, which said that global tobacco deaths, which was the comparison between global tobacco deaths to losing the entire population of Maryland each year. And since I live in Maryland, that's big. And then they also highlighted nationally what this does and how it accounts for up to 480 deaths per year. Some other strengths included how they cited economic costs, to the nation, what it cost us to take care of people who are smoking or who are affected by medical diseases and chronic diseases due to smoking. And I also like the way they emphasized the relationship between the Pennsylvania residents and smoking, highlighting that it's higher than the national average and that they're in the top 10 smoking for the largest cities in the United States, and also that it's the only tie to the leading cause of death in their county and state. Some weaknesses and opportunities. Again, when presenting the evidence-based research, I thought that it would have been nice to hear how smoking impacts the economic cost in the state of Pennsylvania or Philadelphia County directly. I also would have think it would have been an opportunity when sharing the measurable benefits of the proposed program to be a little bit more specific, possibly by highlighting the projected return on investment, how much this would cost and what we gain in return. And then lastly, the successes, highlighting states with similar demographics and smoker stats like in Philadelphia County, highlighting specific data on best practices that have been made and used and why this will make a difference and why this will work for their area as well. So I think all those areas present an opportunity where they can provide more detail. Here are my references, and thank you for watching.